My name is Laura Podolsky. I am the Policy Director at the National Center for Sustainable Transportation. We are a 6-university consortium being led by the Institute of Transportation Studies at UC Davis, and we are committed to advancing a more environmentally sustainable transportation system. And we do that through cutting-edge research, educating our future leaders, and also directly engaging in policy and practitioner-type discussions like the one today. So we're very excited to be here. And we also want to start by thanking one of our main sponsors, Caltrans, and they provided us funding so we could hold forums like this and bring science, academia, practitioners, policymakers all together and have conversations. So we're really thankful for Caltrans' support. I also want to give thanks to our other organizing partners today, and that's Plan for Health, as well as the Center for Climate Change and Health at Public Health Institute. So thank you to our organizing partners. And I also want to do, while I'm up here, is to give a shout out to our planning committee members. You know, we're really thankful to have our planning committee members up front, really helping us guide and develop the agenda today to make sure it was valuable to all of you. So if you are here today, I know not all of our members could make it. Maybe you could give a little wave so we can recognize you. We have Judy Robinson of Sacramento County. There she is, doing her wonderful princess wave. Adrian Inkle and Kieran Kumar with Walk Sacramento. There they are. Adrian is trying to up the game with his wave. We have Cynthia Garcia and Barbara Weller with California Air Resources Board. Did they? Oh, and there's a back. Perfect timing. Great. And we have Daniel Wu with California Department of Public Health. Did he? Oh, he's up here in front. You guys are a great audience. We do have Rafe Porter from SACOG. I don't think he is here today, but do we have any other SACOG staff here? So we do in the back. Great. We want to thank SACOG specifically because they let us be here today. This is great. I love this. We're off to a good start. Marilee Mortensen with Caltrans. Oh, we have Marilee back here. Thank you. And Jonathan London with the Center for Regional Change at UC Davis. He could not make it with us, or he's not with us today. I think he's in Nepal. Alex might know that. Works with Jonathan. He's in Nepal, so he has other things he has doing today. Jacqueline Dewar, is she with us today? Maybe not here yet. Is she coming at all? She's on a bike. She's on her bike. I don't know where. Is she coming here on her bike? Oh, no, I'm sorry. I was there. Oh, she's out of state. Oh. Oh, I like it. We have also Caroline Rodier at UC Davis. She's also serving as one of our moderators. And Neil Maisla, she's one of our speakers today. So just again, thank you to our planning committee members for helping to pull this together. And I'd also like to thank our staff at ITS Davis, Natalie Ruiz, who's closing the doors. We do not disrupt SACOG staff, very important. And then Nai Seyfan, did I say it correctly?
Correct.
Boo, okay, great. And Nai is manning our camera back there because we are recording today. And so we're going to have that recording and we're going to post it later. So if you have any of your colleagues that you want to share today's event with, please do. So that is our quick inner thanks and gratitude. I do want to cover if you need to use the restroom, it's just out this door. Go towards when you came in the elevators, you saw the main SACOG desk. So you head towards that desk and to your right, and there are restrooms. There's lots of signs with arrows. So if those directions that make sense, just look for the signs with arrows. And I also want to stress that we're very thankful for SACOG hosting us today. And so we want to be very respectful that they are working. And so we want to keep all conversations in this room. So if you get a call or you want to talk to one of your colleagues, please take the elevators downstairs and go into the lobby. Otherwise, they're not going to let us use the facility anymore. So you don't want to be the person that ruins it, right? Okay. So, yeah, just make sure that we keep our conversation in here. And if you have to hop on the phone or go downstairs, the elevator into the lobby. Okay, so now we get to the fun part of our day while we're all here. So I just want to say how excited I am to see such a diverse group that has come here today to explore further how do we elevate and talk about health and its implications when we're doing transportation planning and looking at different policy ideas and scenarios. So that's really exciting. We're here to highlight one tool in the toolbox, Integrated Transport and Health Impact Modeling Tool. And this really came about because we have one of the originators, James Woodcock, was in town or in the area. And so we have really felt, we being Neil and Caroline mostly, that this would be a great time to have a discussion on ITHIM and to introduce it to practitioners and those working in policy in the Sacramento region. So how we're going to structure our day is we'll first hear a presentation, an overview from Neil and James, and then we're going to get to a panel discussion with some early users in California. So we're really excited to have some of those early users today. We have Vikrant Sood and Lisa Zorn with Metropolitan Transportation Commission in the Bay Area, and they are down there on the right, or my right. And then we have Seth Scott from Fresno Council of Governments. Look at that way, he's just showing up Judy and Adrian. And then we have Alex Karner, who's formerly with UC Davis, just have to claim that because I am with UC Davis, but is now an assistant professor at Georgia Tech Institute of Technology. So I think you might have been the one that traveled the furthest distance, other than James. He actually beat you. So, but you come in a close second. So very excited today. So everyone, if you have a lunch, great. We are going to end this lunchtime session at 2. And then if you want to stay, please do. We're going to have a more technical session under what I'm calling an under the hood look at ITHIM, where we can really get into some of the more technical questions that people have. And so please stay. That will be 2:15 to 4 in the same room. And everyone should have a printout of all the speaker bios, so I will not get into that. You can just read that if you like. And without further ado, I'm going to hand it over to Neil and James. Oh, and one other thing I have to say. So I know Molly, right? So I'm going to point her out. Molly, you are in front of an active microphone. That means that it is on. So we are going to pick up any conversations that you have. So I just wanted to do that as an FYI for everyone in that area. Okay? All right. Now with that, turn it over to Neil and James.
Well, I have to say how gratifying this is. I'm room filled with colleagues from state government and local health departments and transportation planning agencies. So very gratifying. Most people know me.
Your mic's not on.
My mic's not on.
And I think this one is on. This is live.
Right.
That one.
Hello, testing. Can you hear me better? Yeah, all right. We'll go with this.
Okay.
So I'm just really gratified at the turnout and to see so many of my friends and colleagues over here in public health. What we're going to do now is give you a very quick whirlwind tour of the ITHIM model. And as Laura said, we're going to get into more detail in the afternoon session. So you should just view this as sort of an overview, and there'll probably be lots of questions you have, but we'll be around to answer them. So let me get the clicker. Let's see if this works. Okay, so firstly, what I'd like to do is give a little bit of historical context to the activity. It really started with AB 32, the Global Warming Solutions Act, we passed in 2006, and that the statewide climate action team was formed, and the Department of Public Health joined and established a public health work group, and part of its AB 32 funding, it got a few positions, was to really explore what were the health implications of greenhouse gas mitigation strategies. So that was actually part of our official job, and it was coincided with the creation of the climate and health team in the state health department, and Helen are hearing from that program. So this looking at the sort of implications of greenhouse gas strategies, both the research and also advising other state agencies what the implications of strategies that they were pursuing. So that is really the sort of the crucible out of which ITHIM was born. And looking at health co-benefits and the equity issues were actually very explicitly part of that research. So it culminated in really a feasibility study in 2010 and 11, partnering with the Bay Area Quality Management District, with MTC, and the health department to really find out if such a model, which had been just been recently published in the Lancet Medical Journal, very prestigious medical journal. So the rest is sort of history. It's evolved into more than a feasibility test, because yes, we demonstrated that it was feasible, but also trainings, calibration, and implementations that we'll talk a little bit about. So I'm going to go a little bit about, we've now got to sort of a mature state where there's lots of implementations, not just in California, but if you look at this map, there's now implementations basically all over the country. Nashville, NPO, it's a metropolitan planning organization, the Transportation update, and participation with the Centers for Disease Control, and now CDC has done an implementation looking at a national ITHIM as well, just the physical activity piece. And you can see all along the West Coast there's actually been quite a bit of activity over time. So, as I mentioned, the framing of this initially was coming through the greenhouse gas reduction door. We know how about 37% of our greenhouse gas emissions in California have a transportation origin. So how we can reduce greenhouse gas emissions in transportation really became the focus of our work at the State Health Department. And what are the strategies that will help reduce the greenhouse gases in the transportation sector? And how do we even begin to measure them for sort of the main things? So of course, fortunately, Dr. Woodcock had recently published the early version of ITHIM, and what it really was doing was allowing ways in which we could integrate the many pathways in which health coincides in the transportation sector. So the three main pathways are physical activity that you would get through active transportation, so biking, walking, alone and in conjunction with transit, because you know the first and last mile. So, getting there too, and it's often walk or bike. Road traffic injuries, everyone recognizes that.
You're not being picked up enough by the microphone.
Okay, so I'll get really close. All right. I used to be a musician, so and a rock star. So. A folk musician who, in the heart of every folk musician, is a rock star. Whether they admit it or not. At any rate, the third pathway is air pollution, because if we substitute short urban car trips for biking and walking, we'll also be reducing the tailpipe emissions. So reducing the air pollution is part of the three pathways. So what the ITHIM model actually does is it integrates multiple data sources: health surveys, travel surveys, air pollution data, census, outputs from travel demand models. They all get integrated, and the outcomes are health, CO2, and in the US version we have actual costs as well. Let me go quickly. The physical activity, the diseases that are impacted are heart disease, stroke, diabetes, dementia, depression, colon cancer. These are all health outcomes that have very strong components in which physical activity plays a role in reducing the incidence of these. So these are very important because, as you'll see in a second, well, actually these are among the top 10 conditions that is leading the leading causes of illness and death in the United States, and really cause what we call the burden of disease and injury. So I think it's touching on those things. The physical activity part of ITHIM recognizes that people walk and bike different amounts. It's not that everyone is out there biking and walking. There's a lot of people who actually do very little, but there's some people who do a lot. So this capturing the variability in the population is something that's very attractive to about ITHIM. It captures age and gender effects, and there's also an element that the risks aren't linear. You actually get a lot of health benefit in those first few minutes that you move off the couch and onto biking and walking, rather than the people who are out there doing centuries every weekend or jogging X number of miles. The additional 5 minutes that they spend there won't bring as much risk reduction. So it's really about moving us away from the very sedentary society that we're in and getting people moving just a little bit. Also, as I mentioned, air pollution is one of the endpoints, especially fine particles that drives a lot of the illness. Road traffic injuries as well. And here you can see what some of the numbers are of the leading causes of death in the United States. ITHIM is actually touching on many. So when we talk about shifting the distribution of physical activity, shifting the distribution, again, on a population basis of road traffic injuries and air pollution, we're really talking about the kinds of changes that will have big health impacts. Now, I'm going to switch now to the feasibility study that we did in the Bay Area. And what we did here is we created a blend of scenarios. And we took the business as usual, just assuming whatever policies and practices were in place in 2005, well, they would just continue out for another 20 years. Then we said, oh, let's think about other ways of doing scenarios, of looking at taking the existing trends in biking and walking, just extrapolating them out there to 2035. We also thought about this, it's a what if we could only substitute about half the short urban car trips, biking and walking, what would be the health gain? And then we did a very ambitious, it's really a what if scenario. We actually achieved the Surgeon General's recommendation that every adult get 22 minutes a day of moderate and vigorous physical activity. So it's really asking the question, well, how much benefit is actually there? So what these graphs are showing is that, it's not running marathons. If the baseline is only about 4.5 minutes per person per day, that's a pretty low baseline. Or it's only about three-quarters of a mile. So we're talking about going up to doubling or tripling that, which is 1.5 miles per person per day. It doesn't sound like a marathon to me. But anyway, on a population basis, it's so many people do so little, this can have big shakes. Basically, what we found in the Bay Area was, and you see a range of numbers there. You see percents, which represent the percent of the change of the burden of disease. And we're going to go into details of how we measure that, but anyway, it's a very comprehensive way of life shortening and death. We also, for people who how many deaths would be avoided, well, when you get up to 22 minutes a day, on a population basis, you're talking about thousands of deaths that are prevented every year. See the numbers were actually quite large. This is just breaking down where the benefit is. It's primarily from that physical activity. You can see the big green bar, which is the number of years of life lost that would have been prevented by all this physical activity. You see the red part of the graph, which is below, which indicates what the contribution of road traffic injuries. So here's actually one of the most important findings and why the integration of different health endpoints is so important, because we're looking at traffic injuries, and that actually goes up in the model. It doesn't go down. So that was actually one of the important findings that we had. And it's a real cautionary note, because people are not going to get out there and bike and walk unless they feel safe. So even though you can't really say, well, when you average the red bar and the green bar, you get mostly green. No, it doesn't work that way. There will be people who will be disproportionately impacted. So there's sort of a mode equity issue of bicyclists and pedestrians who are actually generating a lot of the carbon reductions, but they're also getting clobbered on the street with this is what the model is predicting. You can also see there's this tiny blue wedge, which is the health benefit from the air pollution component. And that is, some people are very surprised at it because they so much focus. Air pollution is really important, but there just isn't enough substitution of miles to have a super big impact. And the baseline is really low in the Bay Area. It's already 9 micrograms per cubic meter, which is way below the 12 micrograms per cubic meter threshold. So it started with a very low baseline, and it made a very small contribution. Important nonetheless. This graph is just illustrating what the carbon reductions are, because again, that was the door I entered this conversation through, and it was very interesting. We also examined low carbon driving as one of the alternatives as well. So that really is talking about the electrification of the auto fleet, increasing use of biofuels, and we used research at UC Davis to really give us a sense of what the potential was there. And it's really a range, depending on how it's implemented over the next 20 or 30 years. It could be as little as 9% or maybe 35% as far as the ability to reduce greenhouse gases. So we took somewhere around the middle. And what you can see here, we get the gray bar, which is really business as usual. But then on top of that, you see the light blue bars. And you see these, each scenario that has more and more active transportation gets a bigger and bigger carbon reduction to the point where you get about a 15% reduction in greenhouse gases from this very ambitious level of active transportation. transportation. So when you combine that with low carbon driving, we would actually get to our greenhouse gas reduction goals, which for 2035 would be around a 45% reduction from the 2000 baseline. The state government would use the 2000 baseline carbon emissions as the baseline to measure our progress from AB 32. So this was really a comforting message that with ambitious levels of both low carbon driving and greenhouse gas reductions with active travel, we could actually meet those goals. So again, this big big shift of active transportation brings a lot of health benefits. It also has the capability of generating a lot of greenhouse gas reductions as well. Major diseases are impacted. It would add to the Bay Area life expectancy. When we monetize this, depending on whether we use conservative methods or very more attuned to the regulatory approach, where we give a value to a life, $7.5 million, which is what regulatory agencies do. It would generate anywhere from $4 billion a year to something like $22 billion a year of avoided costs or monetized costs. So that is equivalent to having finished the Bay Area's regional bike plan. At least one year of that would be equivalent to finishing off that. So for policymakers who need to get a sense of how big an impact this is, at the $22 billion, that's about 5% of the gross regional product of the Bay Area in that era. So it can actually be significant. What I'm going to do now is pass this to James. He's going to talk about ITHIM in a broader context. So let me pass it off to James. It's really an honor to have James here. We've been, for years we were emailing back and forth, and we never even saw one another. So it's great for him to be here. Welcome.
Thanks. Thank you so much for inviting me. And it is great to see so many people coming together from different sectors trying to tackle all these problems in an integrated manner. And obviously, while Neil has been doing great things, developing a model here in California and applying and developing, linking to all the US data sets. See, I'm an academic in UK, and we've also been working on other versions of the model, trying to develop it to answer kind of different and related policy questions. So essentially, we can think not just of one item, but of the kind of the line of models that have been developed and extended here, based on the spreadsheet, but then linked up to the US kind of data sets. Then what we call item 2 is being used in research using the software called Analytica, and there have been implementations for London bike sharing scheme. And we've got a new paper just submitted on Sao Paulo, modeling some different scenarios for there. And it's got more functionality, it's got pros and cons. And then what we're working towards now at the moment, what we're calling ITHIM 3, which is an open source web-based tool, and that's currently in development. ITHIM 2 implementing the software called Analytica. This is commercial software you have to pay for. I think actually it was created in California. The model is, it allows you to do a lot more than you can with a spreadsheet. You do a lot of things that you're not able to put in a simple spreadsheet. But unfortunately, it does have its limitations because you have to pay for the software to work with it. I mean, Excel, you do, most people have Excel. And it doesn't have a good web interface. And increasingly, we think that that's something really important. You can have a web interface that people can interact with and use, and that's getting easier and easier. One of the key papers that we did was the London Hire Bike. You see our former Mayor Boris Johnson, who, depending on the referendum, could be our Prime Minister very soon. Someone you probably recognise, and Sadiq Khan, our new Mayor, who's also signing up for the same cycling policy. So hopefully that will see a continuation of the cycling growth that we've seen. And we used the model to investigate what the health benefits were for the population of London with the use of these hire bikes, which have proved very popular and obviously occurring in lots of cities throughout the world. You can include uncertainty and a lot of things that are not possible with the spreadsheet. The aim really overall with ITHIM, I mean, we're trying to sort of bring the different strands together and then work toward what I say is 3 core versions. A US version that would be linked to kind of US data sets, many of which kind of Neil has been working with, but includes the new methods that we've had a chance to develop since then. Similarly, in the UK, a version linked to our data sets, and then a simpler global version which works with much more limited data that will be readily available from many city regions throughout the world, which then, of course, if somebody had the resources, they could develop and take further. So those kind of three linked versions of what we're kind of planning and trying to work out the next stages of how to actually get them. There's a lot of stuff on the methods, development, that I'm going to talk about a bit more in the technical session. Afterwards, we're going to talk about both some of the methods we're doing at the moment, but also what the next steps are with those methods. Because clearly, it's about trying to bring together something that's practically useful, but also has the best science. And I mean, for us, it's very much about trying to have an impact in the work we do. Of course, we also want to be, we need to be publishing good science, because that's how our careers work. So methods in terms of individual level modelling, instead of the kind of aggregate version that you're seeing with the spreadsheet version, which allows you to look at lots of things like inequalities, much more sophisticated scenarios in many ways. What we call propensity-based or data-driven scenarios, which is another way of representing what is possible in terms of behaviour change based on the kind of trips people are doing and how they could work based on data from other settings. Improving the evidence base around physical activity. There's a lot of new work that we're doing on that at the moment. And injury, again, there's both new empirical work and new methods that we're planning on introducing within the injury model already. Some of there within the analytical version, but there's a few more steps forward. And then adding new pathways. And, I mean, most of the impacts are coming from PM 2.5 in the air pollution model, but including NOx and ozone would be more rounded, and I think the evidence is increasingly there to separate out the effects. And noise, there's now good evidence from disease burden studies. Noise is going to have importance. Air pollution in many settings, burden on cardiovascular disease, affecting children, how they learn, affecting sleep. It's very hard to kind of, how you deal with annoyance factor, which comes out as important about how to compare that to harder health benefits. Other key things is, yes, we're working in the R language. We've got a lot of other tools that we're creating using R. It's possible with these add-ons, these kind of shiny and such these great user interfaces that are really nice to work with and have them on the web. And that's something that my team are working on at the moment. And the integration of the transport models. There's some really good transport models, it seems, in California that are ahead of the ones that we have in the UK. I think they'd be great ones to start working with, because they're more, the number of features mean that they're more suitable to this kind of approach than the more aggregate models we have in the UK. But yeah, just saying some of the open source, all the code there on GitHub, so people can take it and they can modify it and turn it into some proprietary software, free development. And some folks in Wisconsin, I think, they kindly started to develop the ITHIM code from the spreadsheet and put that into R already just in the last few weeks. So we're making some progress on that. And there's another project we're working on, SACOG, which is and then the integration with transport models. I don't know if people can see that, but basically you get the output from transport models. They produce a kind of baseline travel behaviour. We then potentially add details from other data sets, which is from travel surveys and so on, to understand more from other physical activity data sets, so that we've got a richer population, which you need for the health impact models to look at the outcomes. So I think here we actually have ethnicity in some of the models already. Then we add in, it produces their own scenarios, but then we also use what we call propensity analysis to produce a kind of set of maybe more far-reaching, more radical scenarios, which can be potentially see what would the health benefits be if we could achieve what other people are achieving in some areas, which is not the kind of thing you get out of the transport models per se. And then they come together with the ITHIM, and that's where the health impact calculations are done. And that's obviously what people want to see, what the health impacts are for these different scenarios integrated across the three traditional pathways and potentially in noise as well.
have a lot of state agencies here say how important their data are in California. So the California Highway Patrol, that's our SWIR's data were part of the modeling effort in California. California Department of Public Health, with death certificates, part of that routine operation, that was incorporated into the model. Caltrans and many other agencies supported the California Household Travel Survey, became an important element of the model. So there's other data sets as well that state agencies and the Department of Finance provided population projections. So many of the state agencies that part of your routine function produce these data, they get the value-added component by the integration in Calvin model. We often, sometimes those very data sets are under assault when budget cuts come, but they are super duper important. So just appreciate your vigilance in getting those surveys and those data sets out, because without that basic information, we would not be able to do this kind of modeling work. So, thank you. And rarely you get a thank you for getting that.
Thank you so much. We keep hearing that this is not picking up, is that right? This is a lot better, right? This handheld one? Okay. So we heard from SACOG staff they cannot turn this guy up anymore unless there's going to be feedback. So we are going to use this one now. And so that means when we have questions from the audience, if whoever answers that from our panel, if you could repeat the question in your microphone. And so it seems your microphones are here. You hold them down to, wait, is this one? I don't know. Oh yeah, this one's always live. So when you do respond, panelists, you hold down the microphone and you speak it, and it sounds like just be really close, get very intimately uncomfortable with your microphone so that everyone can hear. Okay. So that was a whirlwind introduction, we know, and it was really challenging for James and Neil to do this. I know not all of you are modelers. You're just like, what's the model? What are they talking about? So we know it was a whirlwind. We do have time before we head to our panel that Caroline's going to moderate. Just if there are any quick questions, does anyone, I shouldn't say quick. So back here.
So I'm curious what modes of transportation are being considered when you look at pollution in all forms, and where rail transportation fits into the model.
Okay, so question, what modes are considered and where does rail fit in? Okay, and if you are along the edge, you do have a microphone. So if you are on the edge and you have a question, you can always press your microphone too.
Hi, so we actually model all the different modes. So that is car, and it is truck, it is bus, it is rail, it is bike, walk, and motorcycle. So those are all the modes that are modeled. That said, some of the data are more robust than other sources of data, but we do include things like motorcycles because they are, they may not generate a lot of miles traveled, but they do generate a disproportionate number of road traffic injuries. So they are important for that mode. And sometimes we have to do workarounds because the travel surveys and other sources may not always capture some of the modes, but we do model all of them.
Thank you.
Great. Any other questions? We have another one? I'll leave near you if you want.
One thing that I should point out is that in the United States, electric bikes aren't that big of a percentage of the load share quite yet, whereas in the UK and other places. So we have a placeholder in the model, in the US version for putting that in there when it gets to be a significant factor. So that's one mode that we aren't modeling right now.
Okay.
I noticed that there is an absolute increase in injury risk. But I was wondering, when you guys report this out, do you talk about the safeties in numbers effect and how it is safer, per mile for people when there's more cyclists and pedestrians, on the network?
Okay, can you hear me?
So you gotta hold it down, right? Push. Yeah, hold it.
Push
So yes, the safeties in number. What is being referred to here is the observation that as mode share for bicyclists and pedestrians increases, there tends to be a decrease in their injury rate per mile traveled or per minute traveled. So this is, you know, a relationship that's been observed in many places and many times. You know, what is the cause and effect I'm not going to get into because there's controversy on whether it is a result of better safety infrastructure or it's the anticipatory behavior of drivers who see hordes of pedestrians, hordes of bicyclists on the road and then anticipate it and slow down. We don't know if that's part of it as well. But the model does incorporate that idea of a non-linear relationship that as you increase that mode share from biking and walking, the rate goes down. Now, if you have a lot of people out there biking and walking, the rate can be lower, but because there's more of them out there, you can result in an absolute increase in the number of injuries. And that's what we're observing in the modeling, in the scenarios that have very aggressive bike and walk. When we see transit, very aggressive transit, we actually see reductions in injuries due to pedestrians and cyclists, even though there's now an increase for their walking behaviors to transit. Transit is usually the safest mode, so we get benefit there as well. Does that answer it pretty much?
Yes.
Okay, great.
Okay, can we take one or two more questions, then we want to get to the panel?
James had a follow-up.
Oh, James says, okay.
Yeah, just to add to that, the injury model includes the distance by victim, what we call victim mode, which can be all modes, not when I was thinking about pedestrians and cyclists, obviously cars too, but it also includes the striking vehicle. So if you get big reductions, which is one of the reasons why a transit scenario or a scenario which you imagine that you have less vehicle miles travelled, you will get obviously fewer vehicles on the road that are then posing a risk to pedestrians, cyclists and to other motor vehicle occupants and to themselves as well. So the injury model is interesting in that you don't know the direction. If you do more walking, cycling, physical activity, you get more. You get more physical activity. If you've got less vehicle miles travelled, you've got less air pollution. It's obvious the direction, it's the size that matters. The injury model can go up and it can go down. In most of the scenarios we've run so far in California, there has been an increase in injuries, but that's not automatic. It depends on the scenario and the assumptions that are made. If you go further, for example, a small increase might have one direction, and then a larger increase might actually go the other direction. It's quite a volatile.
Stick around for the technical session.
That's the plug.
And you'll see sort of what makes this model so appealing in so many ways is that it has that capacity to model the nuances of travel.
Okay, I'm just going to keep an eye on the time.
Just a quick follow-up on that, but as I understand it, the increase in injuries or deaths from increased walking and bicycling are offset significantly by the improvement in people's health, increased longevity, et cetera, right?
Yes, that is the case, on aggregate. But again, if you're the bicyclist that's hit, you're not going to feel necessarily that.
And we do know that, certainly in the UK, safety concerns are the main reason people give for not cycling, and telling them that objectively it's good for their health, even though that is largely true, it's not sufficient to persuade people if it doesn't feel safe as well.
Okay, so we have one in the back, Judy, and then here, and then we'll get to our panel. So, Judy?
So the way that you collected the data, is it regional, census tract, zip code?
What's the scale of the data, or how, okay, what's the scale of the data? Is this one's not very loud, is that right?
I don't hear it very well. They just gotta speak up.
Okay, so the scale of the data are for the most part, are at the region level. Is this better?
Yeah.
Brings me back. Smoke-filled clubs. Anyway, it's true. So the scale is largely regional, even though Nicholas Leinish, who even if you know, we calibrated the model down to county level. So we haven't really promoted that, but data are there to do this at a county level. The problem is the numbers begin to get very sparse. So when you begin to, some of the calibration items are very specific to age and gender groups. So, the problem is there's not that many, 80-year-old men, on bicycles out there anywhere. So it's sort of an interesting thing, because in public health, we often do our work until the numbers run out and then we stop. But that's not necessarily the culture of other organizations. And in transportation, when you run out of numbers, you basically model it. So now, more and more in public health, we are getting to the, this modeling, which will allow us to go to lower geographic levels. And one of the things that ITHIM 3.0 will specifically address is the ability to do geographically resolved analyses through what's called spatial microsimulation. That's just very fancy terminology to what activity-based model. That world is already there. It's been there for quite some time. And even in public health, we've done spatial microsimulation on communicable disease projects and other things. But in this arena, it hasn't been applied quite as extensively. But that's where it will be heading. So the version we have now could go down to a county level, but it's mostly at the regional level. And we aspire to get down to the census tract. That's why as far as reasonably need to answer many of the policy questions, technical questions.
So one more right here.
I'm Peter Jacobson. I wrote the safety numbers paper back in 2003. And so I'm well aware of the controversy you're talking about. The controversy Neil is addressing is it numbers and safety or safety and numbers? And so I wrote a paper this last fall with two others. And the answer looks to me very clearly that it's safety and numbers. Basically what it amounts to is that people are more willing to ride when it's safer, more willing to walk when it's safer. But that's a small component. And the safety and numbers effect that we see in many, many places is a very large factor. It's like a factor of almost 10. You're much safer walking or biking in Davis than you are in Sacramento, and certainly more than the Sacramento suburbs. So there's two components of why this occurs, why I think it's safety and numbers rather than numbers and safety. And that's one is, the smaller component of the two is you just don't expect, you don't see what you're not expecting. And there's a great video out there called Invisible Gorilla. I don't know, some people have probably seen that. That's that component. If you're not looking for it, you don't see it. But there's also a very strong component of things that are scarce are hard to see. And this is like the scanner at the airport looking at your luggage. He's looking for a knife, a gun, fluids, whatever. They'll miss 95% of this stuff. And this is what the studies have shown. If this thing is rare, if the gun is only in 1 in 1,000 suitcases, they'll miss 95% of those guns. But if the guns are in 1 in 100 of the suitcases, they'll catch like 95%. So the point is that if there's more people out there walking, more people out there biking, you're more likely to see those people. You're looking for them, and you're more likely to see them. And so the question I see that still remains to be answered is, what can we do as road designers to make it more obvious? If you mark these crosswalks, do people start looking, do motorists look for people walking? If you mark bike lanes, do people start thinking, oh, there may be bicyclists on this road? That's a great question that needs to be resolved. And I think that's the pending research.
Great. Thank you for that. I hope people still feel safe traveling in the airport. I know I'm headed there later today.
It's even that for bicycle and pedestrian decoys, like in the high occupancy vehicle lanes where they used to put dummies next to them so they could qualify for 2 or more.
Yeah, I think that's
a lot of decoys out there.
They put guns in suitcases and just put things so scanners are looking for.
Great. That's fabulous. Well, because well, that's your comments. I'm glad that you're here and you comments. That's fabulous. So since we're a clappy group, let's give James and Neil a round of applause. And I'm going to invite Caroline up here, and we're going to start our panel discussion. And I might invite Lisa and Vikrant to scoot in so that you are well within the frame, too, that we're recording. And also, all of our panelists, just again, be very, very close to your mics because we are not sure. And anybody, just please speak up. If you can't hear people, just yell it out.
Yes.
Yes.
Can you turn down your mic so I don't have to keep adjusting my hearing aids.
Oh, goodness, okay, I know, I'm trying to overcompensate here, okay. I don't know how to do that, but we'll just go further away. And I think this one is live, can you guys hear this one? So you just have to speak very close, Caroline, like this. Okay, all right.
Okay, so now we are moving on to our more applied portion of our workshop today. We have some great speakers who are going to start by just giving us kind of a 5-minute overview of how they've used ITHIM and what their experience with ITHIM is and where they kind of are seeing where it will go in the future. So we've got Seth Scott, I think is going to start us off. You're first on the list. He is a GIS specialist from Fresno Council of Governments, and he's going to share his experience with us.
Thank you. Hello? Okay, good. Good afternoon, everybody. So we are, we mentioned that we have some early users in California. I think Fresno COG would be considered a very early user. We're still in the calibration process, but we're looking forward to our regional transportation plan and sustainable community strategy that's going to be coming out in 2018. And so that's our goal, that's our target for implementing ITHIM in our region. This will be our second iteration of the sustainable community strategy. SB 375 hasn't been mentioned yet today, but it's very central to kind of our foray into health modeling and kind of the impetus behind why Fresno COG in particular, and probably a lot of the other metropolitan planning organizations or MPOs in the state, probably have their impetus from this Senate bill from 2008 that requires us, as part of our regional transportation plan, which we've been doing since the 60s, now we have this added component of coupling that with land use planning, and also this idea of looking at the co-benefits, which is a word that's been used today, of these different planning strategies. And so, you know, health would be considered a co-benefit, safety also. And so, as we're anticipating using ITHIM in a more hands-on way, we're looking forward to the ability to quantify these health impacts. Health, and I'll be talking about safety too, probably when we start answering questions, but health and safety both, I think, from a planning perspective, kind of fall into this area of, we know that these things are important, but it's hard to quantify the effects. You know, if we, you know, just to use vulgar language, if we just throw money at health, you know, education, infrastructure, if we just throw money at safety, what are the results going to be? And historically, that's been a very difficult question to ask from a you know, on the ground, you know, numbers perspective. And ITHIM, we're anticipating is very groundbreaking as far as being able to bridge that gap of quantifiability. And I think that ITHIM, just from looking at from the technical side how it works, I think that a lot of the methods that it uses can also cross over into the safety discussion. We were talking about safety and numbers and about, you know, kind of the chicken and the egg. Is it safety and numbers or numbers and safety? You know, numbers and safety, even though the latter, or maybe the former is more significant when the two are compared side by side, but the other, you know, the numbers and safety might still have something to do with it. You know, if we put safety infrastructure, if we put sidewalks, if we put striped bike lanes, if we do, you know, separated bikeways with cycle tracks or something like that, we expect there to be some sort of translation into years of life gained, you know, based off of reduced collisions, more safety. You know, how do you quantify that? And if you stay for the technical section, I know they're going to be talking about the matrix that they put, you know, with the different collision types, and that they have coefficients and things like that. I've been excited to look into how that kind of methodology can be used from the safety perspective to also quantify investment in that arena. So that's where Fresno COG is as far as using this tool.
Great, thank you. So next we are going to move on to Vikram Noon. He's a senior planner
that in the Bay Area, one of the reasons why we are doing a health-related target for our sustainability strategies, in large part because of the advocacy role that the public health departments play, both the Bay Area Regional Health Inequities Initiative as well as the independent county-level public health department. So that was a big driver for why we adopted our targets. And then the second reason for using ITHIM was that in the last SCS, we adopted targets around health that were still transportation related. So it was how much physical activity we would increase through walking and biking, or how many crashes we would reduce. But this time, our board adopted explicitly a health outcomes target. So we needed a tool that would quantify that for us. So the previous targets we could have calculated as part of our transportation management modeling that we already have. So that capability, and Lisa will talk a little bit more about that. But now we needed a health outcomes quantified target for which we needed to evaluate. So we use that to evaluate our scenario. So right now that's where we are. In the whole process, we haven't finished our SCS update yet. We just finished the scenario analysis work, and this tool was used to inform our commissioners how those scenarios and the land use and transportation policies that made up those scenarios, how they would affect health benefits or impacts.
Okay, and I just have kind of a question to the audience. Are you guys all clear on what the difference is between the outcomes of physical activity versus the general health outcomes? You're not, could you clarify that a bit? Because just prior to this meeting a bit, I think that the actual measures that come out are sometimes not completely
I think
clear.
maybe Viola is probably better suited to answer that question. The only thing I would say is that this is another plug for attending the technical session, because even if you're interested in the policy piece, it really helps to see how the model works and what kind of factors it includes, and as importantly, what are the things that it doesn't include, and that also helps. I don't know, Neil, if we covered how the model fits in with the transportation model outputs. So, again, even if you're I sat through a lot of these trainings before, and it made sense, but it still went over the head. And it was only when I started using the actual spreadsheets that would call up me and be like, "What about that?" And he would be like, "Remember, I told you." Go back and look at that spreadsheet, and this kept happening for a month. But really, you get more familiar with the model, the easier it is to understand what it is actually doing, and that's important from a policy perspective. Yeah.
I think it might be helpful.
Yeah.
So I think that I can even respond just a little bit and then so you can provide more. So basically, the physical activity we get from travel demand models, our models tell us how much people walk and bike and the distance that they travel. So I believe that is what MTC did first of all. So what the ITHIM model does is it takes that physical activity data, how people are walking and biking and how much, and then it applies information from the public health field to describe how that will impact public health, how that will affect the disease burden, right? And then there are additional models, there are additional submodels that look at injuries. So if you're biking more, how many injuries you will sustain, and then that's separated out. And then there's the exposure to air pollutants, right? So if we're driving less, or if you're exposed to more, say, PM10 as you're walking or biking, that will also be captured, and then that translates to disease and disability burden, right? Is that
Pretty close.
pretty close? Do you want to?
No, I think that.
Okay, that's how I understand.
So they're all unified by distance and time. So however far people are walking and biking, those minutes of physical activity, we also take into account the intensity of the activity. So that when you're biking at higher velocities, things like that, you're generating more energy output, and that also generates more health benefits. So we're taking not just any old minute, but we're weighting it by its energy equivalent or intensity equivalent, so that you get a much more accurate sense of how much benefit is there, because all the epidemiologic studies have sort of converted these minutes into these energetic equivalents. I'm getting kind of into the weeds now, but these dose-response relationships are well supported by a very large knowledge base of thousands and thousands of people who've been followed up over time, their biking and walking, their physical activity. So we actually know for every extra minute that they're bicycling and walking, you know, what is the reduction in heart disease? What is the reduction in colon cancer, mental health? So we know those kinds of relationships. They come from outside the model. We have this big pool of the best epidemiologic studies done available. So they're not ad hoc, and they're not generated from the population itself, because there could be a lot of biases and things from cross-sectional studies and things like that. So that supports the observation. So if Kant is running the model, you can be assured that it's based on the best available evidence that we have. And Vikrant's actually being very modest, because he's pretty much running it on his own now. So I spent a little bit of time. I mean, really, I spent only maybe 4 hours total coaching these guys, and now they're running this on their own and doing equity analyses, and they're getting subsets of the population, because they, part of their environmental justice, they have to look at different income groups are exposed to the same scenario. So pretty much on their own, they're now pulling this off. The good news is, with a little bit of coaching, it can be a valuable tool that isn't phenomenally expensive. Big investment for NPOs to spend a huge amount of their budget trying to learn how to use it. So I think that's something I want to emphasize as well.
Thank you. Lisa Zorn for MTC.
Hello, does this work? Is that doing anything? Speak into it? Okay, I'll try to project. So I am a travel modeler at MTC. And so my involvement was basically, I develop and apply the travel model that we have. It's called Travel Model 1, very controversial name. And my involvement was that Vikrant basically came to me and said, Lisa, I need a lot of this data for ITHIM. And so I looked at what the data needs were, and looked at and had some conversations with Neil to figure out exactly what needed to come out of the model, and then I ended up scripting it so that it would be sort of smooth and streamlined, and anytime we ran a scenario, we could run ITHIM on the travel model output results. I don't know if I need to talk, I could talk more about the travel model as like a little bit of background, if that would help. I don't know what people's familiarity with the travel demand models are. Yes. So the travel demand models, basically, they take as inputs a simulated population, usually in a future year, but we can also do the base year, of course. And then they're always simulated. And then we also take as inputs travel networks. So that's a transit network, pedestrian network, bicycle network, that kind of thing, and an auto network. And then we simulate things like, where do people work? Where do people travel every day? What do they do? What kind of mode do they choose? And then we apply those trips and those tours to the network and get, as a result, what a typical daily travel pattern looks like. There are some limitations, of course, that, like we've been talking about, we don't capture things like, we're focused on travel for utilitarian purposes and not for recreation, because we're focused, the recreational trips don't usually have capacity issues, or it's a different sort of planning process for those kinds of trips. So we're focused on travel for transportation, and we don't do things like weekend travel. We basically do a typical weekday of travel. So there is definitely limitations, but it's still very applicable to ITHIM. The other thing that I will notice is that we think we're excited about ITHIM 3, because while Excel has some positives, the Excel-based model has some positives because it has a certain amount of transparency. It does add a manual step to the process, and so when we're doing certain things like evaluating projects and how they affect people's travel and terms of, who's winning, who's losing, who's traveling more on transit lines, who's traveling more by different modes. We'll do many, many model runs for lots of different projects, and that kind of thing, it's difficult to do something manual like Excel, but with a more programmatic interface to ITHIM, that would be much more applicable, so we're excited about that.
Thank you. Okay, Alex Turner.
Hi everyone, I hope this works. So my name is Alex Carner, I'm an assistant professor at City and Regional Planning at Georgia Tech. A lot of my work is about sort of transportation equity, affordable housing, has a piece on climate change and health. But a theme that runs through all my work is community engagement and application. So I want to do stuff that sort of impacts the world, and sort of changes things and is timely and relevant. So I try to do work that can sort of get at real world problems and illuminate the implications of transportation planning. So my work with ITHIM started in my postdoc. So I was coming out of my dissertation. For the dissertation, I looked at Plan Bay Area in 2013, and I helped a group of equity advocates do some sort of advocacy around the scenario analysis process there. So they were specifically interested in doing this equity, environment, and jobs scenario model and analyzed by the DC. And there were, that process was a little challenging. There were some successes, and hopefully it's a precedent for the future. Once Plan Bay Area was adopted, the San Joaquin Valley NPOs were the next ones to sort of do their planning process. And there were groups of advocates in the valley that wanted to do something similar. So we got involved with various organizations, Health and Rural Assistance, the Leadership Council for Justice and Accountability. They had gotten some funding from Pew and from Resources Legacy Fund to do sort of advocacy around the regional plan and to try to push their preferred scenario. So we got brought on the Center for Regional Change, where I was working at the time, to sort of help them provide some technical assistance for their advocacy efforts. And they wanted to specifically do a sort of broad health impact assessment. And so we used ITHIM to do a kind of smaller slice. So I basically got in touch, I think I got in touch with Neil. Maybe Neil came in touch with James, we got the spreadsheet. And then I took that spreadsheet and basically did a calibration for Fresno at that time. And we used that spreadsheet to model the health outcomes of the various scenarios. So that's sort of what we did. There were a few things I think that were interesting, hopefully for folks in the room. One is that, we were working on kind of a short timeline. So I think we had about 8 or 9 months where we would do this thing, and it was just me doing it. And it's a bunch of work to do a full calibration. So we just focused on physical activity. So you saw this slide that Neil showed. Physical activity is sort of the most important thing, and we wanted to just get a sense of the health co-benefits. We focused on physical activity, so we didn't do safety or air quality. I tried to make the spreadsheet as user-friendly as I could. So I added things like color coding, additional documentation, tried to write up kind of memos about, okay, if you want to do this type of analysis, you need to go through these steps. This is how you do the calibration. This is what you actually need to, these are how the inputs work in the spreadsheet, and this is how you interpret the output. So trying to make it kind of more user-friendly. Neil had done up some code in SAS, I think, to do some of the early data processing. I'm a big kind of open source guy, so I translated those SAS scripts into R and put them online so that other folks could use them. And then we tried to get, it is at the regional level, we tried to go kind of sub-regional in a defensible way and say, okay, we can make some assumptions about what's going on in these sub-regional geographies. We wanted to specifically look at unincorporated areas in Fresno County. These were sort of communities that were identified by the advocates being particularly important. The other thing I'll say, so the work that Neil showed was kind of based on visionary scenarios. So, and some of the stuff that James was talking about too, if we can sort of imagine what the most ambitious scenario would be, what are the health outcomes? Well, we actually looked at the scenarios that Fresno COG had done, and this is by no means unique to Fresno COG, but the actual scenarios are very similar in the end. So we run the ITHIM, we get results for all the different scenarios, and there are sort of only marginal differences, right? If you know about travel demand modeling, there are a lot of uncertainties inherent in the model, right? So if we're like getting, a difference of 5 or 10 years of life loss between scenarios, like is that actually meaningful given sort of uncertainty that's inherent in the models? So that was one sort of limitation. We were able to show that the scenario that was promoted by the advocates did result in sort of the most health benefits, but it was a sort of small thing. Going forward, we've got a funding request pending to sort of do a similar type of analysis for Sacramento. So hopefully that gets funded and we can do that. Things that I would like to see for the future of ITHIM, I think, would be, continuing around this idea of like user friendliness and documentation and just sort of making it easier for folks to use. Getting folks together that are working on this stuff, I think would be really helpful, like a forum or a mailing list or something for people to kind of share their experiences. And then trying to like decentralize the development of ITHIM would be really good so that you all don't have to do all the work and we can work it together. And the stuff that Lisa was talking about, making it more programmatic, would allow us to sort of make edits and share our edits in real time with other folks, whereas if you edit an Excel spreadsheet and then put it up, it's not easy to see what was changed, right? So if we can do something like that, it would go a long way to make it more useful.
Great, thank you. Thank you. So I think, I'll open it up to the group for questions now to see if anybody have a question for our panel. Yes.
Connectivity or lack of connectivity. How can this be handled in the modeling?
Could you clarify?
Yeah,
a
what
bit
kind of
more?
connectivity? Like network connectivity?
Yeah. You can't get there from here by walking.
Yes. I would say the travel model attempts to get at that because the input networks in the travel model are, they understand that, like, you can't currently bike across the Bay Bridge, you can't walk across the Bay Bridge, and so we're not gonna generate trips like that. So that kind of thing, I mean, the better quality our networks are, the better that is, and historically, actually, bike networks have been less of a focus of travel models because of the small node share. But I think that's changing, and I think that more modelers are trying to work on that, but that's how we get at that kind of thing. So we do, in theory, MTC doesn't, but I know some other travel models do have inputs into their travel models, like exactly what the bike network is, whether it's a type 1, a class 1, a class 2, or a class 3 facility, and then you can get more bicycling in areas where you have a better bike network.
In another tool group about the cycle tool, it's only for England at the moment, but you can see potential flows between areas. You can visualize that as straight lines, and you can see then what it might be if actually mapped to the route network, and the probability or the amount of cycling one expect in the scenarios is based on trip distance and kind of hilliness using algorithms that we've generated. And you can see therefore the difference between, say, straight line, the route network, fast route network, where you might put the infrastructure, and the quiet route network. So that can be used to give some ideas of how much maybe less cycling you might get based on the increases in distance because of the way the route network is structured, where you're going to put in your infrastructure.
Yeah.
Can you just quickly add also, the way ITHIM currently is, the model that we have access to right now, what we're using, the way it interfaces with the travel model is that the outputs that come out of the travel model and the outputs we need are travel distance by mode, age and sex. And that is input into an aggregate across a population into ITHIM. So the question that you're asking is really a travel model question. And it sounds like maybe in England, in the UK, there's a little bit more effort being put into certain elements of that travel model, maybe that these are independent models. But at least with MTC, that kind of enhancement will be made in the travel model so that we get more accurate outputs from it that can be feeding into ITHIM.
And there, I think that across California, there is a movement to provide more explicit representation of walk and bike networks. They're working on it. So, okay, yes.
So a question, again, back to the travel model. And I'm sorry that you keep asking me to speak up, but. So a lot of kids do get a lot of physical activity in parks, but physical activity for adults really is in running errands. So where it might not be picked up.
So where those
those trips may not be picked up, say, because you're only evaluating to and from work or those kinds of things. And we see a VMT reduction because when people get home, then they can ride their bike or they can walk and they choose to take care of some of those errands and destination themed areas. So where do we capture those?
That's a good question. So the way that, so we go into the travel model in a little bit more detail. Well, we have an activity-based tour-based model. So what it means is that people make tours, but they also make sub-tours, and they can also stop along the way. So if you make a work trip and you drive, you know, you're going to choose intermediate stops for that tour based on the fact that you're driving, or they're probably going to be pretty auto-centric tours. But if you make a transit trip, for example, to work, then your intermediate stops and your sub-tours are going to be most likely walk and transit. And so we do capture those types of errands, and there's definitely non-work tours and intermediate stops when people trip chain on their other tours that are incorporated in there.
Yeah, and from Fresno Cog's perspective, we're moving towards an activity-based model, but we still have what's called a four-step model, which doesn't deal with tours. It doesn't track a single person and where they're going to work, and then they're going to pick up their kids, and then they're going to the, you know, it doesn't track that as one tour, but it does capture those individual, you know, legs of the trip. In, you know, we have classifications of different types of trip, you know, home-based work, home-based other, you know, and you know, a home-based other trip would be, I'm home, I need to go to the grocery store, so here's where somebody lives, here's their nearest grocery store, here's where they go. Or a work-based other trip, I'm at work, then I need to go pick up my kid at school, you know, so those different modes, and based off of the travel survey, we're able to disaggregate these individual people that have answered the survey and disaggregate it into those different types of trips and kind of stratify that or project that across the simulated population of the model and say, you know, these are the kinds of trips, you know, that people would go based on, you know, if they're going from home to work, here are the trips. If you know, people going from home to the grocery store or home to this other place, here are the trips. And so all those are captured in a four-step model as well as in an ABM or activity-based model.
Just to say, at the moment, what's happening is that we get the outputs coming out of the activity-based model, and they've been aggregated into ITHIM. But we have other models that we're running that are working with individual level data from travel surveys. And so one big thing that we're hoping to make as the group soon is that when you've got an activity-based model, which are much more popular here than they are in Europe, that we can just stick at the individual level much further. And so we can have the individual level physical activity and only integrate much later on in the model. There may still need to be aggregate models for where many places, some places here, most places back in Europe are still using the kind of more aggregate four-step model. But it will be a real improvement when we've got individual level data to work with individual level data, because then you can look at effects by multiple subgroups at the same time. I mean, we can do it by age and gender at the moment, but what if you want to break down by age, gender, ethnicity, some small area, socioeconomic status, car ownership, all those things? You can't do that with an aggregate model. You just get a nightmare trying to stratify the lots of different things at the same time. We've gone quite far with the analytical model than that. So we have broken down a lot. You can't do it as much as for individuals. You can choose your own breakdown as long as you've got the variables there in the original data set, or you merge them in somehow in a simulated manner.
Okay, great. I think we had a question first over there.
I have a question for the whole panel, but maybe specifically for Alex. I'm interested in using ITHIM as an advocacy tool. I'm curious sort of what was, besides yours, the sort of base knowledge of the groups that you were working with in terms of using a travel model and in terms of their interaction with either their MPO or the transportation folks. Like, how was that information received? Was it done in concert, or, you know, something that was presented as a don't do this, use this information to do something differently? If you could speak to that.
Yeah, I mean, so their interest was in getting this one particular scenario and they had sort of various ideas that were embodied in that scenario that were super important to them. One was that a lot of it was around these unincorporated communities in the San Joaquin Valley, and they wanted investment in those communities. The plan, in their view, the plan that had been pushed, or the sort of status quo plan, would have invested a lot in sort of fringe areas. And they said, look, we don't, the slogan was like, no new towns. We want no new towns, we want investment in existing communities. And so I think, I'm not sure about the details of the funding that they got, but I know Q has been sort of supporting a lot of like health impact assessment work. They're really big on promoting health benefits. So part of the funding from Q involved, they got it so that they could assess the health impacts of the different plans. And they wanted to identify the health benefits of their particular scenario. So in terms of like their knowledge about travel plan modeling, very low to non-existent. But they had worked with folks at the Center for Regional Change before. And so they just reached out to us, started talking with us, said, we want to look at health impacts here. Is this something we can do? The timeline is fuzzy. I mean, this was like, I just finished my dissertation, but I think, maybe, I don't know if I saw Neil speak or something, but I knew that there was this tool out there, and it was one thing we could use, so we just started up discussions with Neil about that. And then there's, the ITHIM work is actually only a small part of it. We did also do just kind of a more general transit access analysis. So how do folks, the number of transit stops they have accessible change under the various scenarios? How many opportunities do they have accessible? Educational opportunities, healthcare opportunities, et cetera. So they just, all they knew was they wanted to sort of get at the benefits, that they wanted to quantify health, and then they came to us and we kind of did that translation. Okay, these are the quantitative tools we have available. This is sort of how we can get at it. Does that answer your question?
Yeah, I think so. I mean, I know there's a lot of people from public health in the room, and we all come at it from a variety of different angles, but all are essentially trying to increase physical activity and active transportation. And I think a lot of the time, if we're going to sort of turn around and say, this is a tool that you can use to advocate for healthy changes in with your community, I'm kind of wondering, like, where's the entrance? Do they have to have existing relationships with you guys? I'm sort of wondering, like, where do we kind of give them a place to start? And maybe, you all can speak to that.
I'd like to speak to that because a lot of those trainings that we've had in California, it's actually been my policy all along, partly because I was in the state health department, that whenever we did a training, a local health department had to participate. It just levels the field as far as what the knowledge is, even though it's still asymmetric because so much of the information is opaque. It's part of the travel modeling process, unless you have been involved in that for some time and made a commitment to understand how those models work. It is very difficult for public health people to understand those things. So I would say it's very difficult for advocacy groups to access the model in and of itself. They really need some kind of partner, whether it's a local health department. Very few advocacy organizations would have technical expertise and credibility to navigate both the health world and the travel model world. So I think partnership is very important for many different reasons. In response to the difficulties of people accessing the spreadsheet version of ITHIM, it has become more and more user-friendly, although it still is you need training, you need some coaching, you need some technical assistance. In a way, no one in public health would expect to walk into a travel modeler's office and in the course of an hour or two come out being a master modeler. I mean, that takes years to achieve those levels of knowledge and sophistication. What I can say is, though, is because the state health department, my role after I left the state health department has been to provide regional calibrated versions so that advocacy groups or NPOs or health departments can now do these kinds of what-if scenarios. And they don't have to be ambitious. They could mirror, it could be a 30-second increase in the average biking and walk time. It doesn't have to be 22 minutes. And you can incrementally answer the question for every additional minute how much benefit it is. I've started to generate some of those curves so that people can then locate where their project might be on those curves and make it much more accessible in that sense, because it is a commitment to calibrate the model, it's a commitment to learn how to use it properly, interpret the output. So I think there's going to need to be other kinds of support tools that will make it more accessible for a broader audience.
I would also encourage, I don't think all the work necessarily has to be done in the non-government organization realm. Like coming from an NPO, Fresno COG, we encourage community groups to partner with us, and we have a very robust outreach strategy. And I actually remember, I think working with Alex on Scenario D, wasn't it? You and I were working on. I was writing you the data, and we were coordinating, and yeah, I was the guy on the other side of the phone on that. So it's cool to make that connection. Like, oh yeah, I remember that. So, and up until that moment in the process, we were doing all that we could to garner input from these groups and to partner with them, and we have feel like a very transparent and open door policy when it comes to that kind of outreach. So whatever region that these advocacy groups that would want to advocate these things are in, I would encourage them to look at their local NPO and look at their outreach strategy and look at how they can plug into the already existing process, because this regional transportation plan, sustainable community strategy, happens every 4 years in every region. Every 4 years, we MPOs go back to the drawing board and we put together a new plan. And increasingly so in Fresno COG, and I'm sure our sister MPOs throughout the state, feel the push towards having robust outreach strategies and considering things like environmental justice and social equity and partnering with these existing organizations that push these things, and we're existing organizations that do the planning and have the technical expertise. It seems like a match made in heaven to me. So I don't think that the NGOs need necessarily feel like they're alone in this effort. That we don't have the resources, we don't have the technical expertise, we're just stuck. I think, at least from our perspective at Fresno COG, we're very open to partnering with these NGOs and helping incorporate, making sure that their voice is heard and incorporated into our existing efforts. It just makes sense to me.
Okay.
If I could just
I'll
add
just
one
let the
thing.
panel, and then I'm going to go to you. Okay. Yeah.
The other thing that Fresno COG does that I think is important to note is you all actually resource the NGOs. So there was a mini grant program that provided small grants to folks, to organizations to basically facilitate their involvement in the plan. I mean, these are cash-strapped organizations. It's often not enough to just say, oh, we had a really open planning process. There were 36 meetings and we had 5,000 impressions on Twitter or whatever. It's like actually put your money where your mouth is and give some money to these folks to actually do the engagement and make sure that it's sort of meaningful and constructive. So that's a pretty unique thing that Fresno COG did that I think is awesome and should be emulated in other locations.
Okay. So we've got a question. We've got to go to our audience question.
Thank you. I'm Linda Helen with the California Department of Public Health Climate Change and Health Equity Program, and I just want to respond to Jesse and actually make a pitch to the group. We are desperately seeking for a research scientist 3 or 4 to come work for us and do this work that started when he was with CDPH and is now vacant. And so if you want to come do this work, please talk to me and apply for our class. And then hopefully that person would then be able to work with communities to some degree. I mean, I'm going to be one person, so I spend all the time doing that, and I have to do other research too, but we hope to be able to provide some of that resource too.
Great.
Okay, great.
So put that job posting on our webpage. What was our next question, Caroline?
Jeannie here.
Yeah, sure. So this is I'm Jeannie Wardwell at the California Bicycle Coalition. I sort of have 2 questions, but maybe they're interrelated. My first one is about a
bill that was passed several years ago, AB 4401, which requires health to be, I'm trying to think what the language was. I think it was the RTP guidelines in the next update, which the CTC is actually undertaking. The CTC is the California Transportation Commission, sorry for the acronyms. They're actually starting right now and are doing between now and the end of the year, but they are tasked with incorporating health and health equity into the guidelines. So I'm just curious how, ITHIM can be a tool. Are we ready to say ITHIM needs to be the tool that all MPOs use in the next round? I mean, can we get down to that point? Are we at that place yet? I know, Fresno COG, you said that you're still at the 4-step model stage, not at the activity-based stage. So maybe you're not all ready to, sort of standardize how we're doing health and how we're incorporating it into the RTPs for the next round. But I'm just sort of thinking about from, an advocate perspective, pushing this process forward. What should we be pushing for in terms of health in the RTP guidelines so that we're seeing better outcomes? And then my second question, sorry that I'm rambling, is related to the state active transportation program and thinking about how a tool like ITHIM and the quantification that we're seeing at the level of these plans can drill down to the level of projects that the state is funding, and how do we start looking at the cost-benefit outcomes at that level? And Caltrans, I know there's some staff here, but they're doing that work now as well, and so how do we inform that work? So, two-part.
All right, so first question, how can ITHIM help influence the guidelines for the RTP? So interested in COGS, you'd be thinking, we're going to put you on the spot too.
I can take a shot at both of the questions. Right now, we're all searching for tools to help us apply for money, or many of the organizations that are out there, want to have these tools. They're being asked in their ATP applications to provide some measure of health benefit and quantify it. And it's been very difficult. And it's related somewhat to Judy's question about scale. And James' response that we need a version of ITHIM that is down, it's disaggregated at the level of a small area in which you can then slice and dice however you want. Now, I don't want to oversell that because, first of all, it doesn't exist right now. And this is a sort of a naked plea that we need funding to do this. I mean, we have been making our rounds to various funders, but this is not a free activity, and we need funding to sustain this kind of activity. So I'll just be very honest. That said, there are potential workarounds. So some of the improvements that I've recently made in the aggregate version does have a population downscaler. And if you're willing to make a number of assumptions, you will get some useful information that will be a workaround while we get to these more sophisticated tools that would be web-based and used in the future. So we need to have volunteers who would want to work with me or other folks to see how this would work out on this idea of just doing it for every region in California, coming up with these curves for every extra minute. And if you have a project that will somehow, if you think that, oh, I think my project's going to add 30 seconds to the average amount of biking and walking, you could go locate what that health benefit would be for an extra 30 seconds. So there may be things we can do now without waiting for the ultimate Cadillac solution. But it is not going to be ultimately validated until we have a disaggregated version that we can then use that will be project level. And I should point out that MTC has used other tools. So your question is, what tools should we be pushing for ITHIM? I think you need a menu of tools, not necessarily, because ITHIM has about 15 inputs that, it takes work to do. So that's not for everybody. And there are simpler models, which is called HEAT, and James is actually on the International Advisory Board for that HEAT tool, which only has a handful of inputs. And I actually helped MTC implement HEAT for their project level analyses. They wanted to know some demographic data and some other things. So there are some other tools that could be used. Each tool so I think maybe not one tool, but it's really the question that matters the most. What is the health impacts of our transportation plans? And then look for what are the tools that will help answer the question.
Well, can we get the COGS to respond to that too? I think that would be helpful too. So that, Jeannie's question is, the RTP guidelines are being updated right now, and how can we better address health in those? Is ITHIM at that point where you all, given your experience with it, to be used? Neil's saying a menu of tools, so very curious for those that are.
I think ITHIM is pretty accessible, so certainly, financially and also technically, I see no reason why any dedicated, an NPO with sufficient staff to do modeling shouldn't be able to plug in and use ITHIM. So I think the question is not so much accessibility. Like as far as imposing, NPOs must use ITHIM. I don't think we're there yet. Nor will that. Again, it's like I think what is happening is that the Pandora's box of let's look at health benefits has been opened and is continuing to be open, and the repercussions of that are being felt throughout the state and throughout the country, throughout the world, perhaps. Now that the word is out that we do have ways to quantify what earlier could not be quantified, I think that just is going to start. Well, the trend has already started, but it's going to further this trend, and it's going to start catching on. And again, from the public advocacy point of view, engage in the public processes that are available. I would encourage that are available to them through their NPOs and local jurisdictions. And if they're not, looking at health benefits, bug them a little bit, and be like, MTC's doing it, President Cobb's doing it. Why aren't you doing it? And I think that kind of getting those values from the public, we hear those in NPOs and we respond to them, and I think that's a powerful tool.
I can just quickly respond to that. I think most of it is being said. I think I agree with Neil that it's more important to ask the question and know what the question is, because that kind of tells you what kind of tool you can use. So Neil already said that we use the HEAT tool at the project level analysis because it's a little easier to use, and we have our CMAs, or congestion management agencies, that currently submit like 1,000 projects to us. So running an item on every one of them would probably take 5 years or something. But it's also like a level of detail that we don't need at the early stages. So we use the HEAT tool at a project level, and then we go to ITHIM when we are doing the analysis of the entire scenario, the entire system of land use and transportation policies. But I think it goes back to the question that was asked here as well, is different tools have different levels of complexity, and they then require different level of skills to use. So if, for example, ITHIM requires a public health department, as an example, to be involved in calibrating the tool, calibrating ITHIM to the local context, and requires somebody like an NPO to be running the model, the transportation model, to give you the outputs. And that's how things work in the Bay Area, where our advocacy community provided us some general, inputs about like the kind of policies that they wanted us to model. So we put that into the transportation model. We ran the model, and then for the results, then we ran that through ITHIM. So it wasn't like the advocates, if they don't trust the NPO, they can't really just run the model by themselves. So is there another tool that they can use, or can they use the what if component of ITHIM? Because for that, you don't really need any travel inputs once ITHIM has been calibrated. So the what if tool would be, for example, you asked the question, what if we double the physical activity for low-income populations? That's something that we're doing right now as an analysis. Then what are the benefits, and how do you quantify those benefits? That's something that a community-based organization can do, because it's plugging in numbers right now in a spreadsheet, and then eventually hopefully in an online tool. And that's much easier than actually working with the, if you don't trust the NPO, then taking their numbers is going to be a little bit of a think the tool is, what tool you use, it's really important to know what question you're asking and then who's using it. So the suite of tools, I think, is the way to go.
I just had a quick practical question about the what if tool. Is that something you're still working on, or will you be posting it, or is it available, or it's a work in progress?
No, the what if tool, we just demoed it on last Thursday with a group of about 12 different organizations, people, and it's working fine. So I need to make a slight change, which I was doing on the way up here on the train. So the problem is I've been reluctant to, even when I was at the State Health Department, put it online because it means you have to respond to people's inquiries. And I had about 4 different jobs at the State Health Department, so it became overwhelming, and it's still overwhelming because it has a sort of an institutional home. It's CDPH, but there's no staff person right now to respond to the questions. So I've always given up whatever version of the model is, have our email, and I'll just send it to you. And we now, some of the things that Alex talked about, we knew that, the documentation needed to be improved, so now it's much more improved documentation. At any rate, if you really want the model to stick around, then if you have a thumb drive, I'll give it to you. It's that sort of thing. James, could I just?
Yeah, follow up. George Fox quote. All models are always something useful. It's trying to find out what the most useful model is for the kind of question that you're asking. In terms of what if, with the new version, the propensity-based scenario, it'll be possible for people to answer in this, and for the people who can integrate with a simpler version of the model, but better scenarios. Say, okay, if our people here have the same probability of cycling to a given distance as people in Davis, compared to people in San Francisco. So you'd be able, those kind of things could be built in. You could answer much cleverer what-if scenarios, but still with a set-up, ready, calibrated version of the model. It still would be possible to start from scratch, because that clearly is going to be a bit of work. But it would be able for a wide range of users with a web tool to interact in a more sophisticated manner than is going to be possible with the spreadsheet version that we have at the moment. And then, it's in terms of the development. Obviously, I'm keen to help. Obviously, I try and get academic funding for methods development as a research, and that is something that's very, important to me. But in terms of getting it, working here in California, then clearly that is something that, does need, kind of financial support and a home. Well, for me, what I want to do is to add in the new methods as they come online, and as we do the research that supports that. It means that we can do the calculations in a better way that gives more reliable answers and sort of new things like that. And that's what's exciting. Well, that's what's important to me as a researcher, but clearly it's how to kind of integrate that with kind of policies and practices that you've got in place here.
Okay, Tracy, I know you have a question.
I'm wondering if any of the panelists can give a few specific examples of how the analyses from ITHIS that you've used to drive specific public policies, either at the city level, unincorporated, or in a larger arena.
Well, we haven't quite got as far as using it yet, so I don't know if we're the best to answer this question. And also just from the perspective of a planning organization, we're sort of in an advisory role to our local jurisdictions. We don't have land use authority. We don't have a whole lot of even transportation authority as far as getting projects on the ground. That's the work of the cities and the counties to do those things. So I think maybe the way the question is phrased may be giving MPOs more credit than we deserve as far as what our actual what our jurisdiction actually is. We're planning organizations, we're putting our plans out there, and we're informing the jurisdictions as to what are the implications of different planning strategies, and then they make the ultimate decision as to how those are put forth as far as actual projects on the ground.
Sure, so do you have an example of how one of your analyses has been used in that way?
I mean, even the alternative D, I mean, was that Alex worked on, did that kind of play out in the process? Or how did it play out?
I mean,
Yeah, I'm having trouble answering the question.
sure. I mean, it's hard to say. Like, did the use of ITHIM in that case lead to breaching? The use of ITHIM and the outputs that it generated were used as part of were used to make the case for the types of policies and land use strategies and all the transportation investments are actually the same. So it wasn't really in that regard, but it was just one piece of making a case for a sort of equity-focused plan. There were some things that came out of that process that were sort of considered breaking in, and this was largely the COG sort of agreeing to do, you all agreed to do like a needs assessment. So sort of detailed, I don't know if you did that, or, I mean, I know that COG did that, I don't know if you personally did that. Yes. So that was considered a win, you know, and the use of ITHIM in that case was sort of one additional data point that said, okay, we follow these strategies, we get sort of additional benefits. But it wasn't sort of, I don't think if we took ITHIM away, then we wouldn't have gotten that, for example. But it was just another sort of observation. Yeah, yeah.
Can I try to take a shot at that too? You know, being on the inside of the CAP team at state level, I think the way the results, especially the Bay Area results, were used was really a policy education that in our greenhouse gas reduction strategies, active transport really can play a much larger role. You know, often, you know, a lot of the emphasis is on the electrification of the auto fleet, which is really important. And we're going to get great greenhouse gas reductions that way. But I think the way it was used by Dr. Rudolph when she was the head of the chronic disease health promotion program in legislative hearings and other things was to really educate policymakers that this is a huge opportunity that we have in California and don't let it slip through our fingers. And being part of a state agency that participated in the scoping plan, you know, we used the results as the scientific justification for why we were saying active transportation. And it was other people who sort of internalized that, some through sort of strains in the health and all policies. So it's not like one thing causes another thing. It was actually a cascade of interlocking influences. So Linda Wheaton and other people who were housing advocates understood what the importance of this potential was and would advocate, even when, you know, sometimes your actual effectiveness is really measured by how other people are taking your argument when you're not making it yourself. And I saw that happen a number of occasions. So, you know, how did that translate into, you know, there's different sort of a pyramid of effects where it's sort of this base level where it may not be showing a specific thing, but it's supporting the people who want to make those advocacy and feel it's really important to have a scientific justification basis for doing that rather than, you know, a non-informed or just advocacy basis. So I think we participated in that process. I mean, we can also, you know, some of the research actually wound up in the third national assessment. You know, the U.S. The U.S. governmental agencies' formal pronouncements about climate change. Well, the ITHIM research was one of the publications there. So, you know, it did get used by other people, and it's still, you know, still happening.
I think to some extent, I mean, there's the data part of it and measurement part of it, and you know, a lot of when we're looking at policy issues at a regional level, if you don't measure it and if you don't quantify it, it's very hard to make a case for allocation of scarce resources. You know, but the other thing is, you know, in 7 words, it has to be a policy priority. So we have, you know, so unless it's a policy priority, it doesn't matter how much data you have. There's a lot of things that we've measured over the years. I mean, the smoking thing, you know, like we knew about cancer and smoking for a long time. That wasn't what changed, you know, a lot of the outcomes. There was a policy intervention when it was determined that it is a priority. So we can measure, unless we measure data, we cannot bring attention to the issue. But it will, I mean, not a lot of action will be taken unless it becomes a policy priority. And I target, and I don't think it has the issue of health inequity and disparities, public health as a public policy benefit discussion hasn't really risen to the top, especially in the Bay Area where right now we're just, we're talking about jobs and we're talking about housing affordability, and we know from literature it all affects health as well, but it's the housing and the jobs that is taking over, the bigger priority, and even in East Africa.
So is that what was kind of the impetus for your board to say they wanted to have this health outcome measure? I mean, really, what pushed your board, or why did they want to do it? Meal?
I can point to people. I think it was a lot of the advocacy or work that the public health departments did. Finding a way to measure something is not the issue, because I can tell you, figuring out how individuals are going to travel 25 years from now, it can't get more ambiguous or abstract than that, and we still have models, and we base billions of dollars of investments on the outputs of those models, and they're doing what they can do with the information that they have. But it was really the advocacy of the California Department of Public Health and our local public health departments, and just I think about 3 different public health departments are now represented on our advisory boards and working groups for Plan Bay Area, which is our regional transportation plan, the SCS.
Okay.
So there is a lot of active engagement, and before we close, I should also say, and Neil is being very modest about the level of effort that he's put in. I mean, essentially, he handed us the model, and it takes a lot of work to do that. It's not just like something that you assign a staff person in public health department to just kind of figure out the calibration for it. You really have to have a staff person who's working with the NPO to calibrate the model, using the travel survey, understanding what our models do, what the travel survey provides, and then calibrating it. So that was a huge, heavy lift that Neil did, which made it very easy for us to say, okay, here's a tool, we can use it. We don't have an excuse not to use it because it's calibrated. We have the model, we just have to plug in our scenario numbers to it. So, the public health department advocated for it and took away all the, our excuses for not developing the tool. But, so it has gotten that far because of that.
Okay.
But, whether it affects our actual investments and policies is something,
Yes.
I'm still trying to understand how ITHIM works and what the inputs and outputs and how it can be useful. Sort of brief introduction was very brief. And I won't be able to stay for the second part, but I'm curious about how the ITHIM model could be used by Caltrans traffic operations when we're determining how to prioritize funding on the state highway system for locations across the state where we're seeing high concentrations of collisions for bikes or pets. If it's applicable, if it's not.
And it sounds like I won't do a bait and switch, but without knowing a little bit more detail, my gut feeling, because I'm an epidemiologist who's done a lot of surveillance, just basically, and it sounds like there may be just a surveillance element in what you're talking about now, of looking at where in detail, what are the facilities, where are the locations. You may already have that data through sweaters or some other things. It would take some thinking, for example, because if you're just talking about the state highway ownership part of that and what's going on. There's enough detail in ITHIM for the road traffic injuries to stratify where the injuries are occurring, whether they're occurring on local roads, whether they're occurring on arterials, or they're occurring on highways. So there may be something that ITHIM could offer. But again, it's a scenario-based tool, so it's unclear to me what the specific scenario, general scenario that you're looking at of, like what if the volume and speed or some other thing increased on state highways, what would be the presentations, district officers when we've done the trainings, San Diego and elsewhere. Actually, it was in Fresno. I think there was a Caltrans district officer who came as well. So some of your staff have actually been through the trainings, so we can leverage that and get their interest. And just talk offline. But I think there's something there.
Okay, yeah, we have one or two more questions, so I'll take Judy.
So I would like to thank Sherry for posing the question around the RTP guidelines. And if she would be open to a friendly amendment, there's parts of ITHIM that obviously aren't ready to go to print yet. But it needs more funding and we need a greater lift. But with the guidelines still being there and health needing to be addressed, it's an opportunity to really encourage and get embedded all the MPOs addressing health in their RTPs, and in their SCSs. So there is an opportunity to be very involved with the guideline update so that health does become a priority. And as we have conversations here in Sacramento with SACOG, they go, well, our projects are only as good as what the cities and the counties bring to it. So we have this chicken and the egg kind of situation, and really project implementation comes at the city and the county level. So I want to make a reality statement is that 3 weeks ago we had a convening in this room where for the first time the planning directors in the region and the public health officers in the regions met. They never met before. So figure out what that looks like with transportation directors and their public health officers. So there needs to be cross-sector coordination and collaboration and dialogue just so folks start understanding what the problems are and what the solutions are. I mean, I really wanted to, bring this conversation, really down to the ground and not so technical, because part of this stuff is really getting people to understand that there are these intersections, and everyone in this room can make that case. And it needs to occur so that then the MPOs become empowered by their board members to start making some of these changes to, leading to my question, how do we get to the point where Nashville is? Where there's a health question in all of their grant programs, and that all of their funding decisions with all of their federal dollars goes towards projects that improve health outcomes and that embed health in their projects. So Caltrans did that with the 2017 ATP. The new guidelines have a scoring criteria that will award 2 to 3 points for engaging with your public health department in answering the health questions. You are absolutely going to get points for engaging and having a very informed response and answer on your grant application. And those 2 points will make a difference between being funded and not being funded. So how do we get to where Nashville is?
Do you want to take a stab at that?
Everyone's being shy.
Because we actually invited Nashville's executive director, Lindsay, maybe you can talk a little bit about that, to talk to the board at Sandbag in San Diego. Anyway, so it was political will. I mean, it was, again, the new executive director who came into the national NPO, who worked with the electeds to set their priority for the region, which was to integrate public health into all of the work that they were going to do. And to some extent, I think they're there. At the state level, we have health and all policies already as a state policy, where multiple departments, in fact, all departments are required to address health outcomes. Right? I mean, I can say that.
No, but there's a tremendous number of state agencies that are participating in the Health and All Policies Task Force, and it is getting it, infused into programs. So,
yes. And another thing maybe to consider, and I don't know how much this is something that you can further in your work, but the state could just say you have to get 25% of your greenhouse gas emission reductions through increasing active transportation. Right now we can spend, I think, about $600 million over the next 25 years to meet all our greenhouse gas emission targets just by investing in clean fuel technologies. And that's a very simple, straightforward way to make the greenhouse gas emission target. But it provides, like Neil's chart was showing, literally no public health benefit other than air quality, which again in the Bay Area is not that bad. crashes would get better with the self-driving cars. Our own modeling is showing all of that. But there is a requirement from the state. I mean, that's one of the simplest ways for things to happen at a regional level. Because again, remember, the counties and the local jurisdictions have the implementation, the policy jurisdiction. The MPOs generally provide, at least in the Bay Area, and it sounds like even in Fresno, and definitely in this Los Angeles region, they provide guidelines and they can put some requirements on things. But really, the money goes from the federal government and the state to the county. So.
Just one last question, or
one more.
yeah, this is it, and then we are going to take a short break.
Okay, so to go back to the local level, it seems like active transportation is something that is often occurring within a jurisdiction, and that a lot of the modeling we're talking about don't even go down to a jurisdiction level. So how can we leverage this? Because talking about active transportation within an MPO is a little obscure when we need sidewalks and bike lanes, and those are things that are very local decisions, and that the planning process doesn't even consider small projects, which may have a huge impact on people's lives in a very small area. So how can we kind of diversify this conversation to include both of these high-level policy decisions, but also to be encouraging local decisions? And can we use some of these models to do that by modeling within jurisdictions? Because from a local perspective, what we're getting is questions about where do we put bike lanes, where do we need to improve things that aren't even included in your models, which are sidewalks and size of roads, things like that.
So this brings up like my pet peeve, and that is that a lot of, at least in the Bay Area, and I know in other regions as well, a lot of the stakeholders are looking to the MPOs for solutions. And my response a lot of times is, well, you have a county government that looks into transportation. So there's a county transportation agency in every county in the state across the country, and your public health department is also a county agency. I mean, this is to some extent, within your own county government, there needs to be a lot more collaboration and partnership and work that needs to happen so that, by the time all of the recommendations come to the regional level, we do like a programmatic analysis. And again, what we do is just programmatic analysis. We're not actually saying you shall now direct money to this project because our analysis shows something else. That's something that happens at the county level. So again, a CMA is a county level agency, public health is a county level agency, there's a planning department, economic development department, housing department, all within county government, and they work much closer to the ground than an MPO does. So a lot of that work, I would argue, needs to happen at that level.
Okay, thank you. Just one last question. Yeah, one last comment.
For very small projects, different approaches may potentially be needed. And I'm currently working with the Department of Transport in England in doing a new version of their web transport guidance that would allow estimation of what are the health benefits of 100 new cycling trips or 100 new walking trips and so on. It works much more simply than ITHIM for evaluation of these kind of small impacts at a local level where you haven't got that much else to go on. So there's other kind of complementary ways of doing this that can potentially be integrated.
Okay, great. So I know some of you have to leave us right now, and that's fine. That's why we tried to cram as much as we could into this 12 to 2 forum. We are going, for those that can stay, that'd be great. I know Neil and James have a more in-depth presentation. They'll get more into the technical weeds, and our panel will stick around too to have an additional conversation. We can talk more about project levels. That's been coming up a lot. So right now, I guess we'll just do another clap. Let's do a round of applause. So everyone will know, we'll have a follow-up email with links to the presentation. There's going to be an evaluation survey. Please take that. We'd really love to hear what you thought about today's